Yesterday I presented a study about the potential role of liquid biopsy in non-oncogene addicted non-small cell lung cancer. Liquid biopsy is one of the new frontiers in translational oncology, but in the field of lung cancer, the main applications now are in EGFR mutated disease. What we wish to do is to understand if there is also an application for non-oncogene addicted non-small cell lung cancer. And we studied the potential role of dynamic monitoring of liquid biopsy during treatment. So what we saw is that it is possible to predict the benefit from systemic treatment by analyzing liquid biopsy at early time points, so at baseline and then after some weeks from the start of systemic treatment. So in this way, we potentially have the possibility to predict long-term clinical benefit and also, hopefully, to understand which are the patients that should change treatment early. For example, we have one case of hyperprogression in lung cancer in a patient treated with immunotherapy, and we had an exceptional increase in the level of a mutation in blood. And so we had a completely different behavior with respect to the other population of patients. So maybe in the future, if we can confirm this data, we can use liquid biopsy assessed maybe some weeks after the beginning of the treatment to predict the risk of hyperprogression even. So this will be very relevant.
Just to check, how many samples were you working with in this study?
Yeah. We have prospectively enrolled till now all the patients receiving systemic treatment, so either chemotherapy or immunotherapy. At the moment of the data analysis, we had collected 162 cases and samples, and we had analyzed in tissue 87 samples, and we have detected tumor-associated genetic alterations. And the data I have presented were about the subgroup of patients that carried the KRAS mutations. So we had analyzed patients who were KRAS positive in tissue till now. So we had 44 cases of KRAS mutated patients, and we analyzed them in plasma during treatment. So now we are also analyzing the other patient by using NGS in plasma, so by analyzing the other sentinel mutation, and we are going on in enrolling other patients. So we are planning to have a higher number of patients, maybe at least 100 patients treated only with immunotherapy, to be analyzed maybe the beginning of the next year, so to confirm the results.
The patients that have been analysed so far, any unexpected markers coming up alongside the KRAS realterations?
Okay, now we have analyzed KRAS mutated patient in plasma by using drop-dead digital PCR. So in this analysis, the first preliminary analysis, we had only the possibility to understand how the level of mutation changes during treatment. So we analyzed only KRAS mutation. In the other patients in which we are analyzing by NGS, we can also explore this secondary point. If there is a change, for example, among KRAS mutated patients, could happen that patient KRAS mutation drop and, for example, P53 rise. So this may have a strong significance from the biological point of view. We are analyzing this data in the next month, probably.
And if anyone wanted to get involved and help with patient recruitment for an expansion, is that ongoing, and where can they be in contact?
Yeah, we are. Till now, it is a mono-institutional study. So we are going on enrolling patients treated with immunotherapy, but yeah, we are open-minded and we hope to increase the number of patients. And I think it will be feasible because now we are using tissue and plasma by using Strack tubes, so we can process them within 2 or 3 days. So I think there is also the time for sending samples. So yeah. It is possible. Yeah, we can.
Okay. Well then, we look forward to hearing more data as it becomes available, maybe this time next year.
In which sense do you mean?
I'm saying we look forward to hearing more from the study, maybe ESMO 2019 with more data, more patients.
Yeah, hopefully. Hopefully.
That covers my notes and questions. Is there anything else that you would like to add? Any further detail?
I don't know. I think that the main point is that liquid biopsy may be used to monitor tumor burden and to help in understanding the response to treatment. And also the most important application is if we have the possibility to customize treatment in the field of immunotherapy, so to understand if there are patients that don't need more intensified treatment, for example combination treatment, because we know that we are a good prognostic group, and other patients that on the contrary need to change treatment or to add chemotherapy and so on. So this is the most important application, and also we are happy to expand our data and to add information by using NGS, because we can understand if there is a role for commutations and changing in the genotyping during treatment and so on.